I've come to get a volumetric non-surgical facelift by Darren and hopefully look fresher and younger and not unhappy and sad, because that's what my face looks at the moment.
You're 53. Okay, fine. So you're into your 50s now and your face has been losing volume probably for the last 30 years. And we can see signs of that around the face, okay? I think one of the key important things to point out is that it's not all about volume loss. In the sort of earlier stages of aging, it's about volume loss in some parts of the face. But as you get older, you start to accumulate volume in other parts of the face, especially around this lower part of the cheek and jaw. So it's important that when we're restoring volume, we're trying to create structure and lift rather than just fattening your face up. And it's creating that structure and lift that is key to us achieving a natural result. And the places that I see as key areas for volume are up here in the temple. You can really see that that's starting to become quite skeletal looking, and it's quite a harsh look to the face. So we're going to build up this area here. You're starting to get really quite hollow under the brow. Okay, so we'll add a bit of volume in there. I know you've had a little bit of filler in here in the past, and this area probably looks a wee bit prominent, okay? So I'm going to counteract that by avoiding putting in any more volume in here, but working on creating some more definition and structure up high over the cheekbone, but right down on top of the bone. The jawline has lost a lot of definition. We're starting to form these jowls, okay? We're not going to get rid of those jowls completely, okay? If you were 10 years younger, I would probably be able to get rid of them for you. But at this stage in the aging process, if you wanted to get rid of them completely, it would be a surgical face and neck lift that you would need. But I can still improve this somewhat by using fillers along the jawline. The lips, we could maybe get a little bit more definition. I know you've had some volume added to the lips before, and I can see that you've still got that. I'm going to try and just create a slightly more youthful shape, see if we can restore the cupid's bow here and try and make the upper lip look a little bit shorter. That will help to create the illusion of the upper lip being a little bit shorter. So I'm just removing any traces of makeup before I cleanse the skin. With the longer lasting types of hyaluronic acid fillers, there is sometimes, or at least there can be, an increased incidence of late onset reactions, and making sure the skin is properly cleansed beforehand, first of all by removing makeup and then by properly cleansing the skin, helps to significantly reduce the risk of those types of reactions. I'm going to start off at the top, so I'm going to start in the temple. The temple is home to quite a few different arteries and veins, so I'm trying to pick a spot where I don't think I'm going to run into any arteries or veins, and then I'm injecting it. I'm injecting the product directly down on top of the bone, on top of the shiny lining of the bone called the periosteum, and then I will use my finger to massage it into the other places that I want it to be, but I can't put my needle directly into because of the arteries and veins. So if we just look straight on, we can see that this temple is now starting to look a bit flatter, whereas this one still looks a bit indented. And when we augment the temple, it also starts to lift the brow as well as the outer corner of the eye, so the eye area just starts to look a bit younger. The product I'm using is Juvederm Voluma. So Juvederm is a brand of hyaluronic acid filler, and I only use hyaluronic acid products because they are reversible. So if someone was to, in the very unlikely event, have an adverse reaction, we can inject something that dissolves the product, which gives everybody a bit of peace of mind. So you've got something that's safe and reversible. So in the worst case scenario, if you don't like the effects of it, you can have it reversed. So now I'm going to move on to addressing the cheek. So because she's quite prominent over there, I'm trying to deflect that by making her slightly more prominent over the lateral aspect of the cheek. So you can maybe just see that tissue expanding as I slowly inject. We've started filling this side of the cheek, and I think you can see that that side's starting to come up and out in comparison to the other side. I've been putting the filler down on top of the bone, and it's lifting up quite nicely, but I think it's starting to look a little bit harsh. So what I'm going to do is I'm going to come back in with a little cannula and just feather a few sort of light touches of filler into the fat to try and soften the contour that we've achieved there. I'm injecting relatively high volumes in the cheek, but it's what she needs. You shouldn't be scared to do high volumes in the cheek if you need it. It's when people do it indiscriminately in the wrong type of face that it causes a problem. Now we've hopefully started to create a bit of lift and shape to the outer part of the cheekbone, I'm going to start to move down towards the jawline. I am now contouring the angle of the jaw, because as we get older, it's not just the skin and soft tissues that change, it's the actual bony structure of the face. And the jawbone wastes away. We lose a lot of bone from the jaw. And because of that loss of structural support for the jawline, you start to notice much more jowl formation. So by restoring the angle of the jaw, we're hopefully going to reduce the appearance of the jowls. You can see it's starting to look a bit sharper and straighter. Now I'm going to move along to the jowls and chin. So again, I'm coming right on top of the bone at the jowl. I've got a really important nerve and artery just about here, so I need to aspirate before I start injecting. Aspiration is basically just drawing back on the syringe, and if the needle was in a vein, then you would get blood coming back into the syringe. So because I don't get any blood back, I know that I'm safe. We've now started to restore a nice, clean, sharp jawline. Now I'm going to start working on building up the lower lip. I'm going to change back to using the cannula again. And again, I use the cannula just wherever I want to inject into fatty tissue rather than on top of bone. A cannula is a little blunt instrument that dissects its way through tissue rather than cuts its way. So it pushes the tissue out of the way rather than a sharp needle which just cuts through everything. And the benefit of a cannula is that it causes less bruising and it causes less swelling. So far I've just filled the lower lip from here to here on that side only, and hopefully you can see that causes the corner of the mouth on this side to turn up in the way that it's still dripping down on that side. So next I'm going to come over here, fill that side, and then I'm going to do a little bit of contouring in the chin. And again, when I'm doing this, a lot of women freak out because it feels really tight, and it kind of feels as though I'm giving you a really big chin that's going to look masculine, and I promise it's not that at all. And we're starting to get there now. I think this cheek looks really nice. I think the jawline on this side also looks really nice and quite sharp. This side, I think she's still a little bit hollow in the lower part of the cheek, which is what we call the submalar region. So I'm going to put a little bit of filler just in here, and I'm going to put a little bit in front of the ear just on that side. And then we'll see where we are. I might also have another little bit along the jawline here. So I'm now going to fill into that lower part of the cheek here, which we call the submalar. This side feels a little bit firmer, kind of feels as though the sun damage on this side might be worse than the other side, which is why I'm injecting more over here. So we've now sort of built up the jaw angle itself, and then I've come in with a cannula into the fatty layer to try and straighten out a bit more, and we're now starting to get a really nice straight definition there. Now I need to make sure the other side looks as good. I'm actually going to do another wee bit just over here in front of the ear, I've tried to do as much lifting as I can through structuring the cheekbones and jawline. And then just as a last finishing touch, I'm just coming into the actual depressions at the corners of the mouth. Next, I'm going to move up to the forehead. As we get older, a couple of things happen in the forehead. First of all, we do lose a bit of volume, we lose a bit of fatty tissue, but the shape of the forehead bone, the frontal bone, changes as well. And it becomes a bit harsher looking, so I'm going to use a couple of really tiny little drops of really soft filler directly on top of the bone. Again, this is one of these really subtle signs of aging that you wouldn't necessarily pick up on yourself, but when you correct it in combination with everything else, it all has an impact. Good, fine. I'm going to use a little bit of filler just in here at the nose to mouth lines. I was going to see if I could get away from that because of the filler that she's got placed here from before. I was trying to avoid using any filler within that sort of middle section of the face, but I think we are going to have to put a wee bit in here, otherwise that's going to compromise the final result. So last thing I'm going to do is a little bit of lip contour. Now she's had a wee bit of filler in her lips in the past, and it's probably been placed a wee bit deeply for my liking. It kind of makes the lip look a little bit more bulky, but without giving it any more shape. So I'm going to just define the edge of the lip just for a slightly more youthful shape, but without trying to make the lip look too big. But now I'm just going to finish off by injecting a few little bits of really nice soft filler on top of the brow bone, which helps to soften the signs of aging around the eye. So I'm just going to finish off with a last couple of little injections to help tilt up the outer corner of the eye, which again I'm putting down on top of the orbital rim, and it helps to support the lateral canthus, which is the tendon at the side of the eye that starts to droop with age. And then last but not least, I've just spotted a wee crease there that I don't like, so I'm going to fill him. And then get yourself sitting comfy.
Oh my god. Oh my goodness. Darren, what have you done to me? Oh my god, this is amazing. Even when I look down the way, oh dear god, I love it. Love it.
Good.
Oh, thank you.
So with Catherine today, we've just used 15 syringes, which sounds like a terrifying amount of filler for most women. Most women, as soon as I suggest more than one syringe, they think, oh my god, he wants to make me look like Katie Price. But hopefully what I've demonstrated with Catherine and the other models on our YouTube channel is that actually it's all about getting the filler in the right place.
That is all going, that is up. It's made my face look younger, fresher, smaller.
Yeah, I think the whole face shape is just more youthful.
It's much more youthful.
But you still look like you, just a younger version.
Oh my, that's amazing. Look how I look younger, look. I'm so happy.